Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll explore VO₂, or oxygen consumption, and why it's one of the most important concepts in cardiovascular physiology. Understanding VO₂ helps explain why the cardiovascular and pulmonary systems work together and lays the foundation for key physiology topics such as cardiac output, stroke volume, and exercise tolerance. Let's begin with the definition. VO₂ represents the volume of oxygen consumed by the body's tissues. In other words, it reflects how much oxygen the body is actually using to produce energy. VO₂ is typically expressed in milliliters of oxygen per kilogram of body weight per minute. It is measured directly during cardiopulmonary exercise testing by analyzing the oxygen and carbon dioxide in the air a person breathes while exercising. We'll discuss exercise testing in greater detail in a future PT microlesson. Now, what determines VO₂? Two major factors. First is cardiac output, which determines how much oxygenated blood is delivered to the tissues. Second is the arteriovenous oxygen difference, or a VO₂ difference, which represents how much oxygen the tissues extract from that blood. Together, oxygen delivery and oxygen extraction determine total oxygen consumption. Let's briefly look at cardiac output. Cardiac output is the amount of blood the heart pumps each minute and is determined by heart rate multiplied by stroke volume. In the next few PT microlessons, we'll take a much closer look at each of these components. If we look closely at the image, it illustrates the arteriovenous oxygen, or AVO₂ difference. Starting on the left, oxygen-rich blood enters the capillaries from the arteriole. As it flows through the capillary bed, oxygen diffuses into the surrounding tissues to support cellular metabolism. The blood then leaves through the venule with a lower oxygen content. The difference between the oxygen content of arterial and venous blood is the arteriovenous oxygen difference. During exercise, working muscles extract more oxygen, resulting in a larger AVO₂ difference and an increase in VO₂. So what does this mean clinically? VO₂ reflects the interaction of the pulmonary, cardiovascular, and muscular systems. When any one of these systems is impaired, oxygen consumption decreases, limiting exercise capacity and functional performance. That's why VO₂ is such an important concept for physical therapists. Let's summarize the key points. VO₂ represents the amount of oxygen consumed by the body's tissues. It depends on both oxygen delivery through cardiac output and oxygen extraction by the tissues. Understanding this relationship provides the foundation for the cardiovascular physiology concepts we'll cover in future PT microlessons. That's it for this PT microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.